Welcome back to Healthy Living. I'm here today with my friend, very honored to be here, Dr. Carlos Montenegro, and we've talked over the years and seen lots of expansions, lots of things shift and change and get better and better and better. Talk to us about Coastal Carolina and the surgical department and what you're doing these days.
Good to see you again,
It
Debi.
really is. I love it.
Well, over the years, we've been already here more than 10 years, I think.
Can't believe it.
Yeah, and we've been doing robotic surgery for 5 years already. So
Robotic surgery, 5 years?
5 years.
Where does time go? No, I
we just did an
don't.
interview about robotics.
I
and,
remember.
We just bought another robotic system, and the hospital is expanding to create another OR because we have so many surgeons coming to operate, and we need more space for them and for the other robotic system.
That's got to be exciting for you. Talk to us about the robotic systems that you have and how that actually improves outcomes and actually makes it easier for the patient and for you, the surgeon.
Yes, we do all sort of robotic surgery here, starting with me, robotic cholecystectomy, appendectomies, repair of hernias, hiatal hernia repair, colectomies. We also have two experienced urologic surgeons who do prostatectomies, nephrectomies, and several gynecologists who do hysterectomies mostly with the robotic system. The advantages of that is that because we use small incisions, the patients recover faster. The robotic arms hold the instruments. They don't put pressure on the abdominal wall of the patient.
Got it.
And that seems to improve the recovery. I have patients who go home after colectomies in 2 days.
And that's a gallbladder?
There's a colon resection.
Okay, got it. Colon
Gallbladder,
resection.
they go home the same day nowadays.
Oh, they do anyway?
Yeah.
Oh, wow. So the
That's
colon resection, and some people go home after that.
So that's one of the advantages. Pain control is a lot better.
Okay.
We used to send patients with a bunch of narcotics at home. Nowadays,
Not so
even
much.
10 pills for the duration of the recovery.
What is one of the misconceptions about robotic surgery? Because I know when people hear it, sometimes they're like, I kind of want a person doing my surgery.
Usually the question is, are you going to be doing the operation or is the robot doing the operation? So yeah, it's there is a lot of confusion, especially nowadays with AI.
Yes,
everything is
that's
AI,
right.
so we think that at some point in the future, robots will be doing the operation. Maybe, maybe not. But nowadays, a robotic system is just like an assistant to the surgeon. We connect all the instruments to the system, and the surgeon controls all the instruments.
So what can people expect if they're coming in? Most of the surgeries that you're doing, like the colon resection, hernias, things like that, what is the average length of stay in the hospital now? Or do we try often to have people go home as soon as possible?
Yeah, most of the operations, let's say gallbladder, hernia surgery, they go home.
Okay.
Colectomies, in my case, removing a portion of the colon or the intestine, they usually stay 2-3 days. Hysterectomies, some of them are going home.
Are they
the same
really?
day, or they stay overnight. Prostatectomies, because a little more involvement, usually 1 or 2 days in the hospital. Same with nephrectomies, removing the kidney.
So when you're doing a surgery, what can a patient expect? Do you see them pre-surgery to kind of chat with them and decide what the procedure and the treatment plan is going to be? And then during surgery and then post-surgery, can you take us through what that would look like for a patient?
Yes, usually we see patients that come through the emergency room. They go there for abdominal pain or what have you, and then they get tests, and then they're told, oh, you have gallstones. So they send that patient to a surgeon, in this case me or one of the other partners, and then we talk to them, examine them, and go over all the tests that they had, and then schedule them for an operation.
Okay.
They
so
come to
scheduled
the
them. Okay, that's interesting. Okay, so it's not always an emergency.
Not always an emergency.
Okay.
There are some cases that come to the emergency room and they need to be done that day or the next day at the latest. So those do happen too. But most of the cases come to the office. We meet them, we interview, and decide what to do, when to do it, if the time allows. And then they come. Like I said, most patients go home the same day.
Amazing.
Some stay 1 or 2, 3 days, and then they go home and carry on with their lives.
Oh, it's really interesting how procedures and just being in and at the hospital has really changed. How have you seen your personal practice shift?
Well, I used to do a lot of laparoscopic surgery where the surgeon is holding all the instruments and all that. Nowadays I do, unless I can't use the robot, I do robotic surgery. So for me personally, it's a lot easier. Sure. Because I'm sitting down and playing with the robot and doing the operation.
Well, of course, it sounds like so much fun.
It's really fun.
Let me ask you a practical question. At what point in time do you suggest people come to the hospital to get an evaluation? Because I know as women or moms or whatever, I would tend to think, oh, do I need to be at the emergency room? Do I need to just call? How do I make that decision? How do you recommend for people to do?
Things like gallstones.
Yes.
Nobody knows they have gallstones until they start having pains, indigestion, or other symptoms. So if that happens, the best is to go to see the primary care doctor.
Okay, so we're starting with
not
primary
the emergency
care.
room.
Okay.
Unless
it's an emergency.
It's a bad pain and nobody's open, then you have to go to the emergency room, no question. But if you start having pains and then it's coming back and getting worse, go see the primary doctor. They'll order some tests, ultrasounds, whatever
it's
tests
necessary,
they need,
sure.
or send to the gastroenterologist or the surgeon for endoscopies, and then go from there.
You know, it's really fun. Every single time we come and chat with you, I learn so much. I think that patients and lay people here really enjoy chatting with you. You make things easy to understand, so we're very grateful for that. And we'll thank Kelly for joining us too. Stay with us, there's more to come here on Healthy Living.